When you think of drug rehab centers, you probably don't picture this, a 10,000 square foot home. This just opened in Claremont County, and the types of users coming here may surprise you.
We're seeing professionals, business executives, housewives, college students. There's certainly a problem with doctors, pharmacists, nurses. It knows no socioeconomic boundaries.
Seeing the need for addiction recovery services that cater to professionals, Dr. Jeffrey Stuckert helped open The Ridge. The Ridge sits secluded on 50 acres, up high on a ridge in Batavia Township. Treatment at The Ridge does come with a price tag. A 28-day program will start at around $19,000. Then again, you have to consider the type of people who are coming here. In Batavia Township, Karen Johnson, News 5.
Good evening. A frightening standoff with police at a local pharmacy this week is bringing to light a dangerous new problem in the tri-state.
Pharmacies and the people who work there targeted for their access to narcotics.
The drugs become as important to these folks as food and water. It's absolutely essential, is what their brain is telling them. Part of the brain is saying, no, we need this. We're seeing oxycodone or Percocet, hydrocodone or Vicodin are the two main culprits.
Stuckert says any solutions to what he calls an epidemic of addiction in Claremont County need to include treatment, preventative education, stricter law enforcement, and educating physicians to recognize addicts when they come in seeking prescriptions.
And we're talking about students in local colleges, we're talking about housewives, we're talking about executives.
Scott Wegener, 9 News.
Heroin is a huge problem here and all over the country. It is so pure it's replaced cocaine as the drug of choice among professionals. It can be snorted, but it is deadly addictive. For those with means, there is a new residential treatment center, the only one in the Ohio Valley. The Ridge has been open for a week. Already some beds are filled.
A limited number of people that need this level of care, but it's sometimes the only thing that works for them.
The Ridge opened 2 weeks ago. The first 3 patients are all into opiates, including heroin.
It's an epidemic. Heroin use is on the rise. We're seeing executives using heroin, college students.
Actor Charlie Sheen would be a good example.
Charlie Sheen could get an opportunity to get better here at the Ridge. Patients won't get better until they're ready to get better, though.
Deborah Dixon, Local 12 News.
How do you start treating someone? What are some of the first things you do if somebody comes to you with an alcohol or a drug addiction and says, I have a problem? Do you immediately go cold turkey, insist they go cold turkey? Do you wean them off their addictive substance? What do you do?
It depends on what the substance is. There's some treatment available for opiate addiction that was not available 10 years ago. The old gold standard was methadone for long-term maintenance for a lot of folks with opiate addiction, for instance, and now there's a new drug, buprenorphine, that has been utilized in the last 8 years quite successfully, and that may or may not be long-term for some folks. Alcohol is a different issue. Alcohol withdrawal can be quite life-threatening as withdrawal from what we call the benzodiazepines, which would include drugs like Xanax or Valium or Ativan. Both benzo withdrawal and alcohol withdrawal can be quite serious, and that should be medically monitored. For listeners, an easy way that I tell folks is that it's continued use despite harm. The inability to stop, control a substance abuse problem is the easiest way for folks to kind of identify with.